Good evening, everyone. I am Dr. Beecher, and this evening we're going to be talking a little bit about COVID-19. So, everybody has by now heard about COVID-19, okay? But just to point out that I'm a little concerned that I'm still not seeing social distancing. All right, we've heard social distance, social distance, social distance. When I go out, I see people speaking in groups very closely together. When I go to the bank, the tax office, the supermarket, I will see a bundle of people outside or a line with people extremely close together trying to get in. So even though social distancing is created within the buildings, there's no social distancing outside. Please remember, at least 3 feet away from somebody else. This is extremely important. Okay? So I was asked some questions and we're just gonna try and answer them quickly. So I'll be reading from the paper. So the first question that a patient asked me, so how you prevent me from catching it? So first of all, as we spoke about before and what we have been doing across the nation, we've been doing enhanced screening measures. So when you call our dental office, you can't just walk in anymore. When you call our dental office, we will probably ask you these questions over the phone. Have you traveled recently? Have you been around anybody who has traveled recently? Have you been around anybody who has had respiratory symptoms, cough, fever, sore throat? Do you yourself have a cough, fever, or sore throat? And we may ask more questions on top of that. When you enter our offices as well, my personal office, we have no-touch thermometers that we use to record your temperature. Okay, so that's another screening tool that we use. We would probably ask you more questions, and we count on your honesty at this time because you are going to be responsible for other people's lives right now. Because even if you have COVID-19 and you're perfectly healthy, right, or you just have mild symptoms, then somebody that doesn't have the greatest immune system could not have the same luck as you in terms of being just fine. All right, so that is basically the first line of defense, the enhanced screening. So second question was, so how will you sanitize anyway? Okay, first of all, at dental offices, we are the most nitpicky people about infection control and cross infection. All right, cross contamination, I should say. Right, so when we finish seeing a patient, of course, all of the instruments are cleared away. We use as much as possible disposable tips, right? So we don't reuse tips between patients. We disinfect all surfaces that come into contact with fluid. So that's like the chair, the light, the table with the instruments, the suction lines. We also, of course, we sterilize instruments. So we don't use the same instruments between patients. Okay, so each patient has their own fresh set of instruments. And also, just 1 second. Right, sorry, this comes in like something that's so routine that you don't really even think about it. But also, we ensure that when we set up for a new patient, that there is barrier film placed over the surfaces that will come into contact with fluids most heavily. Okay, and also just a point to note, the swabs that we use to clean up, they're disposed of. Okay, they're not reused. All right, so the other question is, why are all the dentists closed? Well, first of all the dentist offices are not closed. All right, we have been guided by the Ministry of Health to scale down our offerings to urgent and emergency care. So you can look at another post that we placed about examples of urgent and emergency care, just to help you out a little more. All right, now as dentists, we have the highest risk of infection in terms of catching COVID, because it's a respiratory infection. And what do we deal with but the mouth, which is the gateway to the respiratory system. All right, gateway to several systems actually. So there is that. And 1 second, sorry about that. Sorry, I had baby disturbance. Sorry about that. Okay, Also, you have to consider that for the older professionals in the field that are at the highest risk, they may opt to actually close their practices because of, the great personal risk to them. But the majority of offices, we are still open and we are still offering emergency care. All right, the last question is it okay to go for a dental service if you have respiratory symptoms? What do you think the answer to that one is? No. Okay, no, it's not okay. If you're in any doubt, please call, and I have to read this out now. Please either call the COVID hotline, or you can, let's just give you the website first. You can complete a self-assessment on their website. I just completed it. It's great. And the website is www.jamcovid19.moh.gov.jm. And the hotline numbers are 888-1-LOVE. We all know that one. Also, 888-754-7792. 888-542-5998. Those are the hotline numbers, and ask them for guidance and they will guide you. Okay, don't just show up at an office, please. All right, so we're gonna have another video coming up. It's a 2 parts, right? I just didn't want to do one very long video, but the next video is about oral care with COVID. All right, thanks for watching.